Good afternoon, everyone. No, we could do better than that. Good afternoon. You all have just had a fabulous lunch, and we are so glad to welcome you all back to the final day of the 43rd Annual Conference for Housing California. Have you all had a good time? Come on, did you all have a good time? My name is Kendra Roberts, and I'm the VP of Operations for Human Good Affordable Housing and the second Vice President of Housing California Board of Directors. I want to thank you, as well as all of our sponsors, Housing California's board and staff, our contractors, our volunteers, our conveners, and speakers for achieving such an inspiring conference. We had over 1,600 conference participants this year, and we sold out. Isn't that amazing? We sold out. It was also wonderful for so many of us to be in person together after so many years apart. Before we launch into our closing session of this conference, I would like to introduce Amy Anderson, Senior Vice President of Housing, Affordability, Philanthropy at Wells Fargo. That was a long title. One of our amazing title sponsors for this year. Welcome, Amy.
Thanks so much, Kendra. Good afternoon, everyone. As Kendra said, I'm Amy Anderson with Wells Fargo's Foundation. I want to reiterate that for myself, it is really a thrill to be back in Sacramento and to be live and in person and seeing colleagues for the first time in such a long time. So thanks, Housing California, for helping to make that possible. On behalf of Wells Fargo, it is an honor to be a sponsor of this year's conference. And we at Wells Fargo really want to thank Housing California for the incredible leadership that it provides to the affordable housing community and the crucial work that Housing California does advocating for stable homes for all Californians, but especially those who are economically vulnerable. So last month, Wells Fargo celebrated its 170th anniversary here in California. This is our home. And like all of you, we are committed to working to overcome the state's housing affordability crisis. And we're trying to do that in a myriad of ways. You've seen Wells Fargo's commitment to housing in the amount of capital that we deploy year after year. We have one of the largest affordable housing footprints across California and the country. Last year, we deployed over $5.5 billion in debt and equity investments to finance affordable homes across the United States. Also, throughout the pandemic, we worked with many of you to keep over 300,000 individuals housed with philanthropic support to organizations providing housing counseling and legal assistance, rent relief, and other types of critical eviction prevention services. To help narrow the homeownership gap, Wells Fargo brought $9.5 million in neighborhood lift, down payment assistance, and homebuyer counseling to the Bay Area to improve housing access to 350 first-time homebuyers. Yeah. Wells Fargo is also committed to working with you and housing developers across California to test and scale new strategies for creating more affordable homes. We've made grants this year really intentionally focused on exploring alternative approaches for increasing the supply of affordable housing. For example, Wells Fargo joined in supporting Mercy Housing launch its California Land Acquisition Fund. This is an innovative and potentially replicable model for successfully competing to acquire high-quality sites and ideally produce housing more quickly. With a $3.5 million grant, we also seeded housing partnership networks, adaptive reuse conversion accelerator program to more deeply explore transformation of non-residential buildings like schools and hospitals and commercial buildings into affordable homes. This is a $3.5 million grant that will support over 15 affordable housing developers across the country and 6 here in California. Lastly, I'm really proud to announce that Wells Fargo has awarded $1.3 million in Home Key Accelerator grants to 7 organizations across California. As many of us know, Home Key is a unique opportunity for affordable housing development, but early on, Wells Fargo recognized that nonprofits needed organizational resources to leverage this unprecedented and unanticipated funding for confronting homelessness. Developers like Burbank Housing and Visionary Home Builders use these strategic grant dollars to find and evaluate properties, support pre-development expenses, and perhaps most importantly, to help cover staff time. These grants provided critical capacity, in particular in rural and tribal communities, to help ensure that these areas successfully accessed Home Key funds and were able to build permanent homes for ending homelessness. It is now my honor to introduce our closing plenary for the Housing California Conference this year. During today's closing plenary, you will have the opportunity to hear from Jeff Olivet, the newly appointed Executive Director of the U.S. Interagency Council on Homelessness, and Nan Roman, the President and Chief Executive Officer of the National Alliance to End Homelessness. Nan is retiring this year, and we at Wells Fargo would like to thank her for her many years of incredible leadership at NAEH. She is one of the most successful CEOs and advocates, always figuring out how to work in a bipartisan way, earning great respect for her data-driven solutions, and seeking the wisdom and insights of local organizations and the voices of people who do not have one. Nan and Jeff will engage in a lively conversation to share their bold vision for preventing and ending homelessness at a national scale, how we can approach this work with a racial equity lens, and the role each of us can play in helping to prevent and end homelessness. It is now my honor to welcome Nan and Jeff live and in person to the stage for this conversation.
Well, hello, everybody, and thank you so much to Amy for her kind words. Very, very happy, and to Kendra also. We're so happy to be here today, and I know that I speak for Jeff as well when I say how grateful we are to be with all of you and how great it is to be back in a conference, as everyone else is saying in person, if a little intimidating from moment to moment. But it's great. It's really wonderful to be here. It's my pleasure, in turn, to introduce Jeff Olivet, a longtime and much admired colleague of mine in the effort to end homelessness. Jeff has worked in homelessness, behavioral health, public health for over 25 years in many different roles, as a case manager, as a street outreach worker, as a speaker, a researcher, a policy leader, among other things. He certainly has influenced the field and our approaches to homelessness during that time, so it's great to be here with him. While Jeff has many significant accomplishments, he stands out as the person, I think, who really brought the issue of race and homelessness to the front burner in communities and in the nation. Through the Spark initiative, he initiated a multi-city effort to address racial inequities in homelessness, and for the first time really brought this issue, as I said, to the attention of the field. And the aptly named Spark project got something going that has continued to grow, and a battle that he's continued to fight. So I'm a great admirer. Of course, now Jeff has taken the helm of the U.S. Interagency Council on Homelessness, which is a critical piece of the federal government's role in ending homelessness. The council is tasked with coordinating the federal agencies, the various agencies that have responsibility for homelessness, and working with state and local governments as well. So let me start by talking a little bit about, Jeff, or asking you about what are the first things that you want to accomplish. You've been the head of USICH for 3 weeks?
8 weeks.
8 weeks.
Yeah.
How time flies. In the short run, I mean, I know that you're doing the long-term, the U.S. Interagency Council has its strategic plan, and you'll be coming up with that in the slightly longer term. In the short run, what are some of the things that you feel like need to be done, particularly with the agencies that focus mostly on homelessness, HUD and VA and HHS? What are you trying to get done in the short run, and then what's emerging in terms of the strategic plan in the longer run?
Great, thank you. And it is so good to be here with you all and in the room together. There's just a different level of energy and engagement and connection to each other in the work. So I'm grateful to you all for being here. It's, I think, with heavy hearts that we gather in Sacramento this week after the shooting earlier this week, and our thoughts are certainly with the victims and their families. I learned this morning that one of the women who was killed was herself experiencing homelessness, which took my thoughts to other shootings of folks experiencing homelessness in New York and Washington, D.C. recently, and a tragic event in Salem, Oregon, a couple of weeks ago, where a drunk driver ran into an encampment and killed 4 people who were living without homes. For me, the short-term thing is to frame our conversation about homelessness as a life or death public health crisis. This is an emergency, and every day that goes by, even the days that we're sitting in a wonderful conference like this, every day that goes by, people are dying on the street. People are living in the shelters. People are traumatized. They're experiencing violence. They're experiencing horrific stuff. I was this time yesterday with my colleague Helene on Skid Row in Los Angeles, and you just see the immense human suffering right in front of our very eyes. So we don't have the luxury of time. We don't have the luxury of time either at the federal level or the work that you all are doing locally and at the state level. We've got to move. We've got to be smart and strategic, but we got to move fast. When we get sort of, one step removed and we're talking about all of the reasons it might be that we're seeing slow uptake of emergency housing vouchers or HUD-VASH vouchers or all these other great resources we have, every day that goes by, we're losing brothers and sisters on the street. So I think in the short term, my hope is that we can engage our federal partners and those of you out working in communities in a sense of life and death urgency. And we can talk later about what we've learned during the pandemic maybe, but what we've learned is that we can move fast and we can move well when it's a life and death issue. Well, this is a life and death issue.
Jeff, can I just ask, I know that you and HUD got together, USICH and HUD got together and set up the House America campaign to engage mayors and get them to set goals. And can you just briefly say a little bit about how that, what's going on with that now?
Yeah, if you all don't know about House America, if your community is not already signed on, call your mayor, call your county supervisor, get them signed on. This is an effort that HUD and USICH initiated before I joined to really target all of the recovery funding that came with the CARES Act, with the American Rescue Plan, to make sure that those resources were moving as efficiently and as strategically as possible to address homelessness. And there's really good peer learning and sharing across the different communities. I think we've got about 80 communities across the country signed on to House America now, and it's really cutting new territory for how communities can mobilize these, what I would consider once in a generation level resources. I've been in the field for almost 30 years, and I know you've been doing this work a long time.
7 years.
Only 7 years. Well,
yes.
Congratulations on your premature
my
departure
retirement.
I've never seen anything like this, what we've seen in the last couple of years, just in terms of the resources that we have available. Now, I know those are paired with real strains on your capacity. I mean, I know how worn out people are. I know how stressful the last couple of years has been to just try to do the stuff you were doing already pre-pandemic with just the crisis we've been in collectively over the last 2 years, and attending to your own well-being and your own family and friends. I mean, it's been an incredibly hard couple of years, and we've got this incredible opportunity with unprecedented resources, really. So that, I think we got to hold that tension and still keep moving.
Yeah. And of course, the House America is very similar to the Mayor's Challenge to End Veteran Homelessness that some of you may remember from a few years ago. That ended up cutting veteran homelessness in half. So it really is helpful to get the mayors on board with the numerical goals and so forth about housing people. Really can help. In terms of the strategic plan, any kind of initial thoughts about where you think what that might focus on?
Yeah, I know exactly what it's going to focus on, but I can't tell you.
Okay.
No, that's not true. I can preview a few things. The timeline for the federal strategic plan is later this year. Hopefully by summertime we'll have this out. I had the unique perspective of being on the outside as a stakeholder, trying to influence the plan 1 week, and then actually seeing what the team had put together the next week. And it's incredibly responsive to what our team has heard from the field. The USICH team conducted almost 100 listening sessions. We heard from hundreds and hundreds of people. More than 500 people experiencing homelessness themselves contributed to the plan. And it's going to be important in a whole lot of ways. I think it first of all, aligns all of our efforts at the federal level so that 19 federal agencies are all pointed the same direction on homelessness, which, as you can imagine, is a feat in and of itself. What it can also do is provide you all a blueprint for what you're doing at the state level and at the local level. What you're going to see in that plan, I can preview a little bit. You're going to see a very strong emphasis on equity. We know that people of color are more likely than their white peers to become homeless. That doesn't mean there's no white homelessness, of course there is. But we know that African Americans and Native Americans in particular are at incredibly high rates of homelessness. And that's based on decades of structural racism. I believe that structural racism is a root cause of homelessness. You'll see a very strong focus on racial equity, not just in pretty words, not just sort of as a stated value, but as really operationalized strategies as well. That focus on equity also includes LGBTQ people and people with disabilities and the whole kind of range of intersectional issues that we see people facing. Nan, I know you've talked a lot in your career about the importance of data and really grounding what we're doing on a good understanding of where we're at and what is the data really telling us. You're going to see a very strong focus on data and evidence, and not only trying to get better, higher quality, more real-time data, but also building an evidence base for what works. We've got a good notion of a few things that work. We need to understand better what works. You're also going to see a very strong emphasis on upstream prevention, and this will be new. I don't think I've seen this in a federal strategic plan to end homelessness, where we're spending significant effort focused on how we turn off the faucet. Because in a lot of ways, and you all know this in your work, that you see success stories every day. Those of you who are doing homelessness work, those of you who are doing affordable housing development, those of you who are really trying to provide the support that people need to live stable, connected lives in the community, you see successes every day. But as soon as we witness one person exit homelessness and enter into a home of their own for the first time in a while, somebody else becomes homeless. And so unless we can pair the housing and service solutions on outflow with an upstream prevention that stems inflow, we're only doing half the equation. So the way the plan will look is it'll focus on upstream prevention, really working across systems to make sure people don't become homeless in the first place. How we deal with the crisis right in front of us, particularly unsheltered homelessness, and then how we mobilize and scale up the housing and supportive services that end homelessness for folks. So that whole flow of things that happens before, during, and after homelessness is really very much on our radar screen in this.
In terms of race equity, we were talking a little bit earlier about where we are on that. This obviously, and quite rightly, there's been a sea change around that in the field, I think, of homelessness and affordable housing as well. But where do you feel like we stand? Are we just mostly talking? Are things happening? How do we need to make the switch to that, to more action?
Yeah, I think we've gotten better at talking about race and racism and not so great about doing anything yet. I think that's the crossroads we stand at. And you talked about the Spark study, but that's one of several things that have happened over the last few years. I see my dear colleague Amanda Andiri sitting down here in the front with Funders Together to End Homelessness. Amanda Andiri and our colleague Mark Dones in Seattle and so many organizations across the country have been spearheading an incredible focus on looking at how structural racism and homelessness intersect, what the drivers are, how we understand the structural root causes. In California, we've seen a lot of continuums of care begin to focus on this, the work that Destination Home has done in Santa Clara County, the work that Everyone Home has done in Alameda County, organizations like PATH working statewide and Union Station Homeless Services in LA. A lot of groups are really beginning to focus on how we can respond to the racial inequities we see in homelessness. But it feels like we're right at the front edge of implementation. So racial justice, racial equity is not something we just kind of say and hope something happens. It's something that you implement. It's a set of strategies and tactics and approaches that you put in place to try to drive down the disproportionality that we see.
We're here at the Housing California Conference. Housing is, in my view, the major driver of homelessness, notwithstanding many other things that influence it. But most people also need services, and you've talked a lot about housing at this conference, but I've also heard a lot about the absence of services and the difficulty of housing people who are homeless or who have special needs because the services aren't available. On the public health and health side, there's sometimes, there is a lot of interest in getting people housed because the health side really is the saver. If people get housed, if you spend the money on the housing, the healthcare system saves money. They could maybe invest a little more in the housing side of things. These housing and services partnerships, though, I'm sure many of you have tried to develop them over the years. They seem awfully difficult to accomplish. HUD-VASH was maybe one example where we did accomplish that through federal statute that made the services and the housing come together. What are your thoughts on how these partnerships might be more easily or better obtained and the ways that USICH might be able to help facilitate that?
Yeah, it's a really important question. And those of you who are housers out there and working on the housing side of this, whether it's financing or development or housing residential management, all the good stuff that happens to get people stabilized, that's really only part of the equation for a lot of folks. And often where we've seen difficulties is on the services side. It's that we don't scale up mental health care, we don't scale up substance use treatment, we don't always have ongoing job training and educational supports and trauma-informed approaches that really help people stabilize. And so that has to be a both and it's got to be the housing folks talking with the healthcare folks, the housing folks really collaborating with the behavioral health and workforce development side of things. At the federal level, what we can do is use our convening power across the federal agencies. So you talked about HUD-VASH. For those of you who aren't familiar with HUD-VASH, it is a very formalized partnership between HUD and VA to provide housing and wraparound supports for veterans who've experienced homelessness. It's been a remarkable model. It's been one of the factors that has cut veteran homelessness in half over the last decade, and that's no accident. Like when you provide healthcare and behavioral health supports and a range of other things in conjunction with housing, it's not a complicated equation to figure out. Now, the financing of that is hard, the scaling up of that is hard. You all have some real advantages here in California, I think, around funding, around what Medi-Cal can do, around just how you could get creative about financing services. You've also got some very strong healthcare systems. I know Kaiser Permanente is doing a lot on homelessness now, and there may be other local examples of that as well. I think there need to be very, very strong partnerships between the housing world and the broader health and social services side of things. At the federal level, what I would love to see is what HUD-VASH would look like for non-veterans. Like, let's keep doing HUD-VASH, let's scale that up, let's scale up SSVF and other things that are working for veterans, and then let's take the lessons from those really effective approaches and try that out on young people aging out of foster care. Try that out with families and think about what would be the range of wraparound supports families would need, or single adults who are not necessarily veterans, unattached single women who are incredibly vulnerable group in a lot of ways, living on the street, living in shelters, at risk of rape and sexual assault and exploitation. How can we provide a range of supports that will help that person succeed or that household succeed? So I'd like to take the lessons learned from the HUD-VA collaboration and apply that to other subpopulations, other groups.
Yeah, I think that's. I think we should really think seriously about, because that, you know, HUD-VASH works because it's federally, it's in statute. I mean, it's a federally mandated program to provide this and funded that way. The VA gets money for the services, and HUD gets the vouchers. So it seems like that's something that could work for pretty much any subpopulation, and we should pursue with vigor
Yeah, I agree.
over the next few years.
And I mean, a couple of other dimensions of this. I don't know how many of you saw President Biden's State of the Union address a couple of weeks ago where he unveiled the White House Mental Health Initiative. We're in collaboration with that team to try to really align the White House's significant push on addressing the mental health needs of all Americans and make sure that people experiencing homelessness and housing stability are represented in that conversation. The same with efforts on addressing the opiate epidemic and increase in methamphetamine use, and really looking at drug policy and how we can make sure the substance abuse prevention and treatment side of things within Health and Human Services is really connected to the work we're doing with HUD as well.
Absolutely. Lots of opportunity there to make progress. The homelessness sector got a lot of funding through the CARES Act and the American Rescue Plan. Here in California, there's also, from what I understand, considerable amount of state money that's being focused on homelessness. Despite all of the issues, there's enough money coming to the state to make a dent in homelessness, make a difference in the number of people who experience homelessness here in California, to reduce it. I join with what I think you said earlier, Jeff, that this is a once-in-a-lifetime situation, that we're not going to have this kind of money ever again, I don't think. Do you think, Jeff, that we're using these resources as strategically as we should with respect to reducing homelessness specifically? And if yes, say why, and if no, ideas about what we should be doing smarter.
You know, I think there's a real tension between the urgency that I talked about right at the beginning of my comments with the notion of getting it right. We want to move fast, but we don't want to just push. If we take emergency housing vouchers as an example, you don't want to just use them to run down the waiting list for the Public Housing Authority, because those then might not be going to the folks who are in most desperate need of a housing voucher. The same on, Project Room Key, which has been incredibly successful from what I've seen in the work that you all have done. Now Project Home Key, being really thoughtful about how you target those resources, who you're doing outreach to and connecting with those resources, how we make sure that the housing resources are distributed in an equitable way so that we're not inadvertently perpetuating racial inequities. I think those are really hard things to figure out. And so you don't want speed to kind of replicate some of the failures we've had in the past. You want to move with urgency, but do it in a way that is very thoughtful and very strategic. So I look at the numbers in the federal spreadsheets about utilization of some of these resources, and some communities I see have pushed things out the door very quickly, which in some cases is good, in some cases has been flailing a little bit just to move things out. Others I see hardly utilizing the resources they have. I'm concerned about both ends of that. Folks who are either moving too quickly and not doing it in a way that's strategic, or not moving fast enough, and we've got a mismatch between these theoretical resources and people living on Skid Row or living under the bridge here in Sacramento. How do you balance that tension between speed and strategy? I think that's the challenge many people in this room are facing. That was
Yeah.
a way of not answering that question, by the way.
Good job.
Yeah.
The other way to look at that too, I think, is, I mean, certainly I know when these resources first came out, especially the housing vouchers, I think the home money is, I'm not sure what's going on, not as clear about what's going on there, but we got a lot of information from the field and even from housing authorities saying we really just can't house the hard-to-serve people, the people on the street and so forth, because we don't have the services, back to the services point, and really not being very willing to take people even who just are homeless but didn't have any particular service needs, much less people with more serious needs. And that seemed to, you know, I think we are definitely gonna have to address these services issues if we're gonna get people into housing. But everybody's got to work together on that. I don't think
That's right.
it can just be.
Everybody at all levels. So at the federal government, what that means is we, in our convening role, try to get HUD and Health and Human Services working very well together. At the state level, that means your housing department and your health department working really well together. At the local level, that means partnering with providers and putting memoranda of understanding in place and really engaging with your health systems and trying to make sure that the resources that are available are getting to the people who need them most. So I think there's a real disconnect often between those who are working on addressing the crisis of homelessness, you know, just really dealing with this emergency here right now and trying to get people stabilized, with the broader health and behavioral health system who may or may not be engaged in that work. I think some communities do that better than others. But we all have a role to play in that, in making sure these pieces connect at the federal, state, and local level.
So I guess the extreme that proves the rule on that is unsheltered homelessness. You have the sad distinction here in California of being the state with the largest homeless population of any state, and 70% of whom are unsheltered. I don't think any other state anywhere near that percentage of unsheltered population. And it doesn't seem that very many unsheltered people are getting housing opportunities, not none, but it's definitely not targeted in that direction. And as you said, it is a very complicated issue, but you know, this is what we're facing at the moment. So what are some things that you think that communities could be doing to get more unsheltered people into housing? Should they be targeting the units differently? Should they be designing home resources in ways that focus on unsheltered people? Any thoughts about strategies?
Yeah, one thing that we're looking at very carefully is the effective strategies communities are putting in place to deal with encampments. You know, encampments aren't the only kind of unsheltered homelessness. We see people living in vehicles, we see people in all kinds of circumstances, but we know encampments are often the most kind of visible manifestation of homelessness. This is what the general public often sees and is horrified by. It's what often political leaders are under pressure to address. And we see some communities do that poorly, where it's basically driven by law enforcement, but with no connection to housing and services. That's not effective. You can't just hope to arrest our way out of unsheltered homelessness or sweep an encampment with no plan for housing people and hope it doesn't pop up across town somewhere else or come right back where it was. So one thing we're trying to do is identify what some of those best practices are, and often what it's looking like is a very targeted, time-bound strategy that includes homeless service providers, housers, public housing authority, health departments, sometimes law enforcement, but in very much a backseat role in terms of kind of ensuring safety of everyone, and connecting those folks who have been so marginalized to housing. Now, it would be ideal if that was permanent, if it were just an immediate flow from street into housing with a lot of services. Sometimes the affordable housing is just not there. And even if somebody does have a voucher, it might be very difficult to find a landlord who will take that voucher. We know that happens. So there are some in the meantime strategies that are going to be important. And it kind of breaks my heart when we are starting to talk about shelter and starting to talk about tiny homes and sanctioned encampments and safe parking facilities. And some of those things might need to be in place just to help stabilize folks as we figure out the longer-term housing. I don't think that has to be sequential. I would hope we can still really embrace a housing-first approach that says housing is the fundamental solution and it's the prerequisite for health. What our friends in the Healthcare for the Homeless movement say is that housing is healthcare. It's not that you get sober and then you've somehow earned housing, or that you are required or should be required to address your mental health issues in order to qualify for housing. That's backwards. How do you do that? How do you stop using drugs and alcohol if you're staying on the street? How do you attend to your mental health or your trauma history if you're living in a shelter? It's impossible. It's antithetical. So housing has to be the stable foundation from which health and wellness and reconnection can happen. And we understand that there might be some bridges that need to be built from the kind of immediate crisis of unsheltered homelessness as we're trying to figure out the permanent housing solutions on a large enough scale.
Mm-hmm. Well, so what you're describing basically is a housing-first approach. And this has been on a bit of a cycle, Housing First, as a way to address homelessness. No one had heard of it, and then it was introduced, and people started to adopt it. And now it's policy at the federal level, at least at HUD. And I think in the state also, I'm not 100% sure about that. But it's not exactly sure, it's not, what Housing First isn't always exactly the same. And you see a lot of programs, for example, that say, yes, we have, people participate in treatment, and when they're done with their treatment, they get housing first. And things like that. It's, in my mind, certainly, that's what it means is that people need to get what you said, the stability of a home as soon as possible in order, like any of the rest of us would need to do, in order to take on any serious problems that we have or address any needs that we have. But the model is getting a little politicized now, and some people are saying that Housing First is the reason that the homeless numbers have been going up. The homeless numbers haven't actually been going up that much, and I'm not sure what your data is in California, but and that Housing First is causing the problems of unsheltered homelessness and so forth. Any thoughts about that, and how you think we could get a better discussion going about the place of housing in helping very vulnerable people?
I have a lot of thoughts about that.
Maybe just a few thoughts about that?
A few thoughts about that. I think it is a real miscalculation to say that Housing First is a failure, and that's the reason we're seeing increases in homelessness in some communities. It would be like saying, look, we still have COVID with us. The vaccine must not work. It makes no sense. It is not the cause. The cause is that housing costs are out of control, that wages don't match up with what it actually costs for people to be in housing. Housing First has not been a failure. I am a firm believer. I was a street outreach worker and a case manager before we had Housing First in the 90s. And we were making people have 6 months of sobriety before they moved into housing, and we were making people go see a psychiatrist before they were qualifying for transitional housing, and it was not working. It would maybe work for some people, but it was not working for a whole bunch of people for the reasons I described a minute ago. Hard to address those things while you're still homeless. If we abandon Housing First now, it is a 25-year step backwards in public policy. It would be a fundamental mistake to do it. Now, one problem is that we've never scaled it up to meet the need. We've done a little bit of Housing First for a problem this big. The other thing is that we've never stopped inflow. And so I think if we could scale up the stuff that's working, Housing First is a strongly evidence-based intervention. But that doesn't just mean housing only. We don't just put people in an apartment and hope for the best. That's not effective, and it's not Housing First. Housing First says people may need and want a whole range of services and supports. Let's make sure those are available, but let's not make housing contingent on that. Any more than my housing should be contingent on whether I go see my primary care doctor. These are separate things, right? So how do we make the services available on a scale necessary in a way that people who are stabilized in housing can access those as they need to and want to. So there's a question of scale, there's a question of fidelity to the model. Let's not call things housing first that aren't housing first. I think that's one of the reasons housing first has gotten a bad rap, is we put people into apartments, hope for the best, and say, look, we did housing first, and then opponents can say that didn't work. Well, it was never housing first to begin with. So I think there are a number of factors in this debate, but to politicize housing first, to say housing first is the reason that we have homelessness on a large scale now, is bad public policy analysis. And it's taking an approach that was bipartisan 15 years ago. The George W. Bush administration was beginning to embrace this policy. The Obama administration embraced this policy. Even in the early years of the Trump administration, we were seeing housing first as the predominant agreed upon way of doing this. It's really just in recent years that it's become to be politicized, and I think it's really unfortunate, and I think it can do us real harm. I tried to keep that brief, Nan. I don't know if that was... Yeah.
That was good.
Yeah.
You'll remember in the Trump administration, it was housing first, second, and third, from the HUD Secretary's interpretation of housing first.
We've also heard people in my position in the past say, I believe in housing fourth. And I don't believe in housing fourth. I believe housing is the fundamental solution to homelessness and is the stable foundation from which all other good stuff can happen. Right. It's got to be first.
That's right. Well, having said that, sometimes it feels like getting everyone safe, stable, affordable housing just might be impossible. It seems like we're moving away from that goal instead of toward that goal. What do you say to yourself during those times when you know what the answer is? The answer is housing, and we just can't get enough of it. It's just not there. That's the solution, and it's just not available. How do you think about it? What should we be keeping in mind when we hit setbacks in areas like that, when we just aren't quite there in terms of the supply of housing?
Yeah, I was really, one book that helped me in the early days of the pandemic was the Book of Joy, which is a set of dialogues between the Dalai Lama and Archbishop Desmond Tutu. Add that to your Housing First reading list, the Book of Joy. What they say is when you're in the middle of a crisis, when you're having an incredibly hard time, individually or as a society, zoom back out from that a little bit. Picture it 5 years from now or 10 years from now. Try to keep it in some kind of perspective. One thing I do is look at the historical sweep of this. We know that homelessness as we know it now has not always been the reality in this country. There is a long history of homelessness that goes back to our earliest days, but it has ebbed and flowed. And so after the Great Depression, the country invested a huge amount of infrastructure in housing, in healthcare, made Medicare and Medicaid the policies of the country, brought in Social Security, really built a safety net, including public housing, including the Section 8 program in the 70s, some really good public policy. And in 1970, we actually had a surplus of affordable housing of about 1 million units. By 1990, that was a deficit of 6 million units. And it was no accident. There was a disinvestment in affordable housing at the federal level from 1972 to 1992 by about 80%. So try this in your public policy hat. Cut investment in housing by 80%, throw in a little bit of deinstitutionalization and veterans returning from Vietnam, slash the safety net for families, and see if homelessness actually happens. And if you zoom back out, that's exactly what happened in the 70s and 80s to lay the groundwork for where we are now. The hope that gives me is that it does not have to be this way. If we designed that system, if we made those public policy choices, we can design a different system. We can make better public policy choices.
Very good. Thank you, Jeff. Really appreciate that. We're very, very glad to have you at USICH and look forward to your great success in rebuilding that system. And very, very grateful for your leadership. And now, before we end today's session, I want to turn it back over to Kendra Roberts to provide a few concluding remarks before everyone heads out to the last set of workshops this afternoon. Thank you all.
Thank you.
Thank you.
Thank you, Nan and Jeff, for joining us in California and for sharing your knowledge and insights with us today. about our collective efforts to prevent and end homelessness in California and nationwide. We were blessed by the conversation. Thank you. And thank you again to Wells Fargo for your sponsorship of, and for being our title sponsor. We appreciate you all as well. And again, thank you to everyone who had something to do with this conference, from our staff to our vendors to our board members to every participant. We thank you for your participation. We hope that you found this conference inspirational, made new connections, and gathered knowledge to continue this critical work in California. Please do not forget to complete the end of conference on the app, the end of conference survey on the app. And we look forward to seeing you at Housing California's 44th annual conference in 2023, in person, hopefully. Stay tuned for details and dates. Thank you all and have a beautiful afternoon.